Welcome back, everyone. Thank you for being here. Today we have Dr. Uwaye, who's going to be talking about retinoblastoma, and we're going to just keep it simple so it's easy to understand. Okay, over to you. Take it away, Dr.
All
Uwaye.
right, nice to be here once again. So retinoblastoma, it's the commonest tumor
In childhood?
Yes, not in childhood, intraocular tumor in children.
In children,
Yes.
okay.
So one would ask, so a child can have cancer or even cancer of the eyes? So this involves the retina. Of course, it does happen. And for this retinoblastoma, it's usually, there are two ways it presents, in the sense that it can be inherited, and those in hereditary forms are the ones that present much earlier. So from 1 year to 15 months, or even before 2 years, the child would have a tumor that is involving the retina.
The retina, which is the back of the eye.
Exactly, the back of the eyes.
Where all the blood vessels and everything are.
Yes, or it could be non-hereditary, where they may present much later in life. But basically, what happens for a child who we suspect has retinoblastoma, this child would have one of the first signs we see is what we call leukocoria, where we have the loss of the normal red reflex. So the child has something that we call a white cat eye.
Cat eyes.
Yes, cat eyes.
Yes.
So some people would even bring a picture. I've seen a mother who brings a picture and say one
eye
is
red,
the other one is white.
And those are moms who are
observant.
Yes, very observant.
So somebody will say, this child looks awkward, but meanwhile, there's a problem in there.
Yes.
So it's very important to take note of that.
Yes.
Then another way it can present is strabismus, cross eyes, or the child bumping into objects, loss of vision.
Because they can't see.
They can't
from
see
that eye.
Exactly. They can't see very well. So it's something that we see, especially in our environments, though there's good response to treatment in a developed world. But in our environment, we have a lot of late presentations. So that really affects the prognosis and the outcome that we see with these children. And how do we make a diagnosis? So this child we have the red flags, the clinical features, and we now make sure that this child is being seen by a pediatric ophthalmologist. No, before we even send the oncologist, where they have an examination under anesthesia. And then have to look into the eyes, and they're able to make the diagnosis. And of course, even having an a scan. Orbital scan can help in seeing calcifications and all of that.
From the tumor.
Yes. And it's very important to ensure that there is no cranial extension. So the child,
they don't need to have a CT scan anyway.
Exactly. They would prefer the MRI because of exposure to radiation.
That's another thing. CT scans and radiation.
Yes.
So we want to make sure that we're doing CT scans only for children that really need it, like a child like this who has retinoblastoma.
Yes. So you must ensure that you've ruled out, that's what we call a trilateral retinoblastoma, where there's pineal involvement in the brain.
Oh, wow. Yes. It's spread to the brain.
Spread to the brain. For a child you suspect, because the outcome will be quite different, mode of management may be a little bit different, so it's very important. Then the child,
of course, and everything.
Exactly. Will be managed by the pediatric oncologist.
Right.
So there's room for laser therapy, there's room for cryotherapy.
What about surgery?
Surgery, at some point, enucleation of the affected eyes, to take it out and put a prosthetic in.
Wow.
Yes.
Wow. So they can't save that eye?
No, we may not be able to salvage, depending on the stage.
Yes, depending on the
stage. We have a lot of late presentations in our environment. So they've gone here, they've gone there. Nobody wants to present to the hospital until you see the child with a protruding eyeball.
But that's also why, as doctors, it's important that every child that is born or every newborn child that comes, first visit for a newborn, you need to make sure you're checking the red reflexes.
Very important, so that you don't miss it.
Yes, that has to be documented, because 3 months down the line or a year down the line, you want to look at your notes when you saw the child in the newborn period and say, but this child didn't have, the red reflexes were present in both eyes when the child was 6 weeks old. So docs, very important, always do your red reflexes and document. And as soon as there's a suspicion for this kind of diagnosis, send them to the appropriate doctors, pediatric,
very important, oncologists
and pediatric ophthalmologists, so that they can get the care that they need.
Yes, and if this child has, if it's of the hereditary retinoblastoma, screening for other children in the home
family,
matters.
That's a good point.
So you schedule them 6 monthly, over time a yearly, to be sure that it's they're fine and it doesn't come up in any of them, so that one can quickly refer them and treatment starts, and it helps the outcome.
Okay.
It does help the outcome.
Yes, it does.
So I've seen a lot of children who have had retinoblastoma picked up early.
And they're fine.
Undergo their chemotherapy. They've had probably maybe enucleation,
Yes,
and they're fine. They're fine.
Wow.
But eventually, it's one of those cancers that you want to be sure there are no secondary malignancies. Yes,
Okay.
retinoblastoma.
Like where?
Sarcoma can come up.
Okay.
So they have tendencies for secondary malignancies.
Osteosarcomas of the bone?
Yes.
Wow.
Yes.
So there's a connection there.
Yes. So they are usually monitored closely for secondary malignancies.
Wow.
Yes. Wow.
All right.
Very important.
So moms and dads, very important. Just once you get the diagnosis or when your baby's born, just ask the doctor, did you do a red reflex on my child's eyes? Just so that everybody's on the same page. And that way, early diagnosis can be done for a child who's at risk for retinoblastoma. Thank you, doctor.
Thank you, ma'am.
And we'll see you next time, mom and dad, and everyone watching. Bye-bye.
Bye.